I am Coenen. I'm the new Executive Director for Rutgers since January 2016. Before I started working at Rutgers, I was the CEO for AIDS Funds and STI AIDS Netherlands, worked both nationally and internationally, and before that I worked in public health in the Netherlands. And I've chosen to work for the sexual and reproductive health field because I think it's a very interesting field where still a lot of difference can be made. I think Rutgers is a very unique organization. When you look at the history of Rutgers and also of sexual health in the Netherlands, then Rutgers has played a very important role. Certainly in the 60s and 70s of the last century, the Rutgers were really famous for access to contraceptives. That led to a lot of national work that Rutgers has been doing, and based on that, Rutgers also started to do international work. When we look at some of the issues, for example, in the Netherlands itself, 200,000 young people become sexually active every year. And we know that there are issues around that. For example, 4 out of 10 girls and 1 out of 10 boys have experienced sexual behavior which they don't like. So I think that is really important that we work on that. And internationally, issues are way bigger even. For example, the 220 million women who don't have access to contraceptives that they would like to have. In 80 countries, homosexuality is illegal in one way or the other. And when we look at the development of the world population, there are several issues. In sub-Saharan Africa, there's 1.2, 1.4 billion people living in the region. That will become 4 billion by the end of this century. We think it's crucial that every girl and every woman can make her own choice on when and how many children she actually wants to have. Often when women have their own choice and make their own choice, they will choose for the first child at a later age and fewer children overall. What I really think is unique about Rutgers is that Rutgers addresses rights issues, sexual health issues, reproductive health issues that a lot of organizations or governments cannot really directly address or do not want to address. There are several plans for 2016. Well, first of all, the organization acquired several big programs for the next 5 years, so they need to be created and they need to be built in this year. And the second is that I want to develop, together with the organization of course, a new strategy to make sure that we have a sharp vision for the next 5-6 years. Part of that, in my view, that the interventions we have and that do work, that we can scale them up. What I really like is that there is a lot of collaboration between the different departments. For example, if we implement programs, it's not just about implementation. We also connect it to research because we want to know which interventions work and which ones don't work. And then also we connect the interventions and the research with lobby work that we do. We can't do this alone, we can't change the world alone, we only can do this in partnership with so many others. And that's why I'm proud of all the partners that we have.